Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of December 20th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or email us at admin@rootsclinic.org. As you can see here, cases in the United States are going sharply up, and unfortunately, so are hospitalizations. Here in Alameda County, we are seeing an uptick in cases and also an uptick in hospitalizations. We'll continue to keep a close eye, particularly on these hospitalization metrics, because that is something that we are particularly concerned with as we head into a winter surge, which is looking like it is going to be exacerbated by the new Omicron variant. So we know that the first case of Omicron was detected here in the United States in early December, probably got here in late November. And about 2 weeks ago, the week ending December 11th, it was at an estimated 13% of our positive COVID-19 cases here in the United States. And it has just been doubling at a rate of, it looks like it's been doubling about every couple of days. And so we know how doubling works. That is exponential growth. So if you think of it like compounded interest, we know that it just keeps going up and up when you have a doubling time that is that short. And so according to the CDC, Omicron is now dominant. It now represents 73% of new COVID-19 infections, and that is for the week ending December 18th. So in just 1 week, went from 13% to 73%, and so that is certainly concerning just all by itself, basically how quickly it is becoming the dominant strain. So I think that some of the bad news is clear. It is definitely more transmissible in terms of its ability to spread among people who are vaccinated and unvaccinated. We don't know exactly how much more contagious it is. So, for example, if it were to just let loose in a completely unvaccinated population, how that compares to Delta specifically. We'll continue to learn a lot more of those nuances, but certainly there is evidence that it is evading some of our antibody responses in particular. And so that is why people who are vaccinated are still able to catch the Omicron variant. It does still appear, though, that and this is the good news part, that our sort of second line of defense, that T-cell immunity, there's not really evidence yet that Omicron has evolved enough to completely evade that sort of second line of defense, our T-cell immunity. And I think it's just hard for to completely wipe out kind of that that robust response that we get with our immune system. But certainly that initial army of antibodies, we already know that that's strongest right after you get vaccinated, and we always expect that to taper off over time. But unfortunately, it has tapered off to such an extent that now the recommendation is to kind of boost the effectiveness of the vaccines. So you remember before we had you can get vaccinated if you're 18 and up. Now it's really changed to a should recommendation for everyone 18 and up. And those that are 16 and 17 can get the booster dose. Remember, that's 2 months after J&J or 6 months after your mRNA vaccines. And definitely if you're in the immunocompromised group, then you actually don't even need to wait the 6 months. It's actually 30 days after your primary series that you would need that third dose. So all of this will raise basically the effectiveness of the vaccines and make it less likely to catch the Omicron variant. It still does appear that the vaccination, particularly with the booster, addition of the booster, that it is protecting against the most severe outcomes, hospitalization and death. But it's still early to say just how, how sick is Omicron making people compared to Delta. And definitely our biggest concern certainly is those who are remaining unvaccinated. But also, our big concern is just the sheer numbers that we're looking at. So, huge numbers mean that even if only a small percent become severe cases, it could still challenge our hospital capacity. And this could mean that hospitals not only overflow in terms of COVID patients, but also that even for other reasons, it may be hard to get in. So we know that many hospitals across the country are canceling elective procedures and things of that nature kind of in preparation for this. And some parts of the country are already overwhelmed. And that is certainly devastating to see. And we're seeing some scrambling going on for patients that need to be sent to another hospital, another county, even another state because of overflowing. And so we'll be keeping a close eye on this, and also just waiting for, I think, more information, more data to really see all of the nuances, because at this point it's almost that we need to know how is it behaving in each age group, because we know the vulnerabilities are different for each age group as well as the comorbidities, but also in fully vaccinated, vaccinated and boosted, people who've had COVID, people who've had COVID and been vaccinated, and so on. And so we have all these subgroups, and it does make it a lot more difficult to draw quick conclusions, but at least we are having some time to at least get the word out. And I think really kind of back in a little bit of a hunkering down moment, I think is the most advisable while we're seeing such a rapid increase of cases, and the amount of uncertainty that we have, and heading into the holidays. I know that certainly people are reassessing their plans, and I think that that is a wise thing to do, and at least see how things can be done safer. And so I think the other component of that caution is that unfortunately our toolkit is getting a little smaller, which is not what we want to be experiencing right now as we prepare ourselves for this winter surge. And what I mean by that is that the most commonly available monoclonal antibody treatments, and those are the ones that are produced by Regeneron and Eli Lilly, and those are the ones that are the most widely available, do not appear to be effective against the Omicron variant. So this is pretty unwelcome news here. And so what is happening is that the Health and Human Services has decided to pause distributing the one monoclonal antibody treatment that does seem to be helping, which is sotrovimab. And that one, we have a limited supply of that one. And so there's been a pause on distributing that one, and they will be shipping, actually as we speak, really 55,000 doses. That's not very much, to state health departments. And so they should be arriving, and then they are anticipating a few 100,000 more in the first week of January. So hopefully when people need it, it will be there for them. And one of the challenges that we have now is that I think in many parts of the country, Delta is still predominating, and those Regeneron or Eli Lilly products will work fine, but we're not always going to know which is which. That is a little bit of a blind spot that we have. And so I am hopeful that we'll be able to get better and quicker lab confirmation of whether this is likely Omicron or not. Because if it's not, then we can go ahead with the monoclonal antibody treatment that we have. And if it is, then we may need to be thinking about either that other monoclonal antibody, the sotrovimab, or the molnupiravir, which is the pill, which we know is not nearly as effective as monoclonal antibodies, but it at least does appear to have some activity against Omicron. So that is a concern, that we may not have the one outpatient treatment that really does appear to be effective may no longer be a tool in our armamentarium, and therefore, we'll need to wait and see what the supply and distribution of the one monoclonal antibody, sotrovimab, is going to look like. And in terms of good news, Paxlovid, which is Pfizer's pill, you might remember we had preliminary data that showed that it was very effective in reducing hospitalization and death, and this is a pill form, and they Pfizer did put out their final data, which is 2,246 patients who were high risk and enrolled in the trial, and they were 88% reduced risk of hospitalization or death within 5 days of symptom onset. So that is really, really remarkable. There was no deaths in the treatment group, and the hospitalization and death was reduced by 88%. So that is phenomenal. And in Europe, their agency, that's kind of like our FDA, did issue kind of an emergency, basically, that people who are not yet requiring oxygen and who are at increased risk of progressing to severe disease can get Paxlovid. So we're definitely hoping that the FDA here will follow close behind and be able to approve Paxlovid. Paxlovid is a protease inhibitor, so you may have heard of this category of medications as it relates to HIV. Protease inhibitors were actually kind of a game changer as it relates to HIV treatment, and we're hoping that it will be the same here in terms of treatment of SARS-CoV-2 infection. It should be, just like most antivirals, should be administered as soon as possible after diagnosis of COVID-19. Has to be within 5 days of the start of symptoms. So, of course, we have to get tested to know if we're positive. And so testing is extremely important. And the United States has already committed to purchasing 10 million courses of this Paxlovid. It's 2 tablets twice a day for 5 days. It does look to be effective against Omicron, and based on the mechanism of action, based on how it works, there's no reason to think that it would have reduced effectiveness against different variants as well. So this is good, definitely good news. They're already shipping product into the United States, and so it's anticipated that as soon as it's approved, it will actually be available. So that would be some welcome good news if that can happen. Ideally this month, but I don't have a date on when that is going before the FDA yet, but they do have all of this final data from Pfizer. They have submitted it, so hopefully we'll be hearing any day now. And by way of children's vaccine updates, some more bad news and good news. So there has been ongoing evaluation of the Pfizer vaccine for our little ones, 6 months old to under 5. And they have been testing a 3 microgram dose. And so remember that our 5 to 12-year-olds are getting a 10 microgram dose, and 12 and up are getting the 30 microgram dose. And so with this 3 microgram dose, they basically have gotten poorer than expected results, particularly in the 2 to 5-year-old group. So there was no safety concern, so that is very good news, but it did not produce a robust immune response. The 2 doses did not produce a robust immune response in kids 2 to 5. So basically what they did is that the study is actually ongoing and remains a blinded study. So this is a good thing. They didn't disrupt the study, but they had a planned kind of sub-analysis of how effective it is, which is known as immunogenicity. And they conducted this analysis on a subset of the participants in the study 1 month after they received dose 2. And they compare it, which is how they kind of do these different sort of bridging studies. They compared it to the immunogenicity that we saw in the 16 to 25-year-old population, where we know that very high efficacy was demonstrated. And things actually looked pretty good for the 6 month to 24-month-old population. So 6 months to 2 years old, It looked effective or non-inferior, as they say. So non-inferiority standard was met for 6-month-old to 24-month-old, but not for the 2 to 5-year-old population. So again, good news is no safety concern, because that's always what we worry about. Now it is a little dose, the 3 microgram dose, and it had, the good safety profile, but and it may be okay for the littlest ones, but for the 2 to 5-year-old group, not good enough. So what they're doing is they are going to now include a third 3 microgram dose 2 months after the second dose of the 2-dose series, and see if we get high enough levels of protection in this young age group. And remember, as I've talked about many times, it really may be that this is becomes a 3-dose vaccine in the future, like many of our childhood vaccines are. And what they're really trying to do is maximize the benefit while keeping the risk low. And so it appears that they're sticking with this low 3 microgram dose, but they're looking at a third dose. So if the 3-dose part of the study is successful, then Pfizer and biotech will submit that data to the regulators, and they'll be submitting for the emergency use authorization. And they are now saying, before they said end of 2021, now they're saying first half of 2022. I know a lot of parents are anxiously waiting. This is sort of our last completely unvaccinated group for SARS-CoV-2 is our under 5-year-olds. And so we will be waiting to hear about that. In other Pfizer trial news, they are also planning to evaluate a third dose of the 10 microgram formulation for our 5 to 12-year-olds. And they've also initiated a lower dose kind of study, like a sub-study, to look at a third dose of 10 micrograms in the adolescent age group, the 12 to 17-year-olds. Remember, they usually get the 30 microgram dose, so they're going to be checking out a third dose, both in a 10 microgram and in a 30 microgram dose. So we'll be waiting to see what they find in terms of both the effectiveness or the immunogenicity, as well as the safety in that age group and at those doses. So that is the update. Things are moving along. Certainly not what we had hoped to hear at this juncture, but we'll just have to stay tuned on that one. Good news about the 5 to 11-year-olds. The ACIP, which is the CDC's Advisory Committee for Immunization Practices, met last week, and they reviewed the 5 to 11-year-old vaccinations and all of the safety data that has come in. This was looking at all the vaccines administered to 5 to 11-year-olds up to December 9th, 2021. It's about a month. And that is over 7 million doses. So 7,141,428 doses were administered in the 5 to 11-year-old age group. And what they did was review all of the safety data. And I know that a lot of parents have been anxiously awaiting this information. It is here now in over 7 million doses having been administered. So I'm going to review this now and just want to say that this is not about the effectiveness. The effectiveness was essentially established in the trial, and we're going to have to see more about how long that lasts and if there needs to be a third dose, and all those things will be for the future. Right now, this is really focused on safety. And so they reviewed our safety data from 3 different sources, which are the same ones they've been reviewing each time, and we've kind of gone over the safety of the vaccines. The first one is called VSafe. This is the voluntary program of the CDC. It's based on your smartphone, and it's a monitoring program. And if you've gotten the vaccine, you've probably gotten the information about how to sign up for VSafe. It's kind of a text messaging thing where they ask you about any side effects that you've had. And this is really important. I would encourage everyone who's getting vaccinated, particularly for your little ones, because the more information, the better. And so we can all contribute to the knowledge base by actually voluntarily just enrolling in this VSafe program. And they will just ask you how you're doing by text. And if anything comes up, they actually will follow up with you and make sure it gets reported to VAERS and so on. And so you can see here in this graphic that basically you sign up for it. You get these check-ins daily for the first week and then weekly through 6 weeks. And then at 3, 6, and 12 months. And you just complete a little survey. And if you had any clinically important event, then you actually will get a call and they'll go ahead and assist in making a report if needed. So again, encourage everyone to do that. But what they've found so far, they've gotten close to 70,000 reports, and that's a combination of the first dose and the second dose reports in VSafe. And so that is only about 1% of the doses given so far. And probably not a very representative sample. 84% of the respondents were white. It was not a very diverse group. But, you know, I think we could still take what it is that was shown here. And that is that most of the reactions, were mild and transient. The majority of them actually occurred on day 0 or day 1 after receiving the vaccine. And they were consistent with the side effects that were seen in the trial. So pain at the injection site, followed by fever, fatigue, headache, and sore muscles, muscle aches. And so this is also similar to what we saw in older children and in adults as well, but appears to be less so in this age group. And less than 10% reported having to miss school. So right now, while most of the children are on their winter break, this may be a good time to go ahead and get the vaccine because we don't have to worry about that part about missing school. Very few reported seeking any kind of medical care. And so very excellent safety profile thus far, very reassuring. And again, that's a self-report from the VSafe monitoring. The second source is the one that I think gets talked about a lot, is the VAERS, or the Vaccine Adverse Event Reporting System. This is also sort of a passive reporting system where anyone can really report adverse effects. Physicians use it, vaccinators use it, patients, family members, anyone can use it. And it's used in order to kind of detect signals that then researchers can dig into further. And this is how they've picked up any of the prior signals that have come up until now. Now, with this age group, there were a little over 3,000 reports to VAERS up until December 9th, so 3,233. 97% of those are non-serious. So that is reassuring. Now, we don't know how representative this sample is, primarily because 1/3 of the reports don't have race specified, so not really sure how representative this is or not. But the vast majority, again, of reactions happen on the day of the vaccine or the next day, were mild and transient. The most common adverse events were actually vaccination errors. And so this was sort of like the wrong dose given and so on. And I know we've all heard some of these things in the news that happened, particularly in the early part of the rollout. I think most places have gotten their bugs worked out. But you know, there's no harm in asking. Just take a look and let them show you what they're giving your child, and it should be 10 microgram dose. And then the other adverse events were the ones I mentioned before, the ones that were observed in the clinical trials. With the 3% that were serious, the top 3 were fever, vomiting, and chest pain. And those were, again, a very small percentage of overall vaccination, actually not statistically significant at all. And when it comes to the myocarditis, which is what I think we were all really waiting for and concerned with, because remember, in some of the younger adult age groups, this is a significant thing that we need to be on the lookout for, is myocarditis, particularly in that younger adult age group, 16 to 24 or so, and something that we just want to be aware of so we can get attention right away, even though they do all tend to resolve well. And we know that the risk of catching or of getting myocarditis if you catch COVID is much higher than with the vaccine, but nonetheless, we always want to be aware of potential adverse reactions. And the good news is that we haven't seen it in this age group, which is a big relief. Because we know that in the initial trial it wasn't necessarily large enough to see that 1 in a million or 1 in 500,000 or whatever. But now that we're over 7 million doses having been administered, there have only been 8 cases of myocarditis in this group, so that is not significant. It's actually infinitesimally small, and they all appear to be mild and have recovered or are in the process of recovering. And so that is certainly very, very reassuring news. It looks very different from the young adult population. And so there really is not a reason for us to be concerned about myocarditis in this 5 to 11 age group. And there has been no other safety signal whatsoever that has been noted. And I'll just say briefly on the third source is called the Vaccine Safety Data Link. And this includes 9 large hospital systems across the country. And as of December 14th, they had reported 333,000 doses having been administered, and within that vaccine safety data link system was 0 confirmed reports of myocarditis. So again, very reassuring. And so at this point, as we sort of brace ourselves, I think, for the winter surge, and it is hard to predict when that is going to happen, but since we're already seeing an uptick of cases, then I think we are feeling concerned about the weeks to come, and weeks and month and a half to come, as to what we will see in terms of the magnitude of our winter surge, is how high it will go, and if it will overwhelm our hospital systems. There's still a lot that we don't know in terms of how well is everyone protected from the most serious outcomes, and again, in all of those scenarios that I mentioned, vaccinated or vaccinated plus having had a history of COVID or having had COVID. But we know that by and large, the biggest concern is going to be our remaining unvaccinated. We really want to make sure that we are not getting distracted by boosters. I think if you're eligible, you want to get a booster, please get a booster. It is definitely the recommendation now in light of the Omicron variant. But by far, who we are worried about losing this winter are our unvaccinated individuals. And so we want to understand what it is that they need to know and need to learn in order to make their decision to receive the vaccine. We want to make sure that if you are pregnant, you're not waiting because it might be too late. So we want to urge those who are pregnant to receive the vaccine. I went into this in detail in a prior briefing. If you need to dig that one up and send it to anyone that you know who's pregnant, because we still are unfortunately hearing and seeing that we don't have as good of uptake among our pregnant moms. And we just want to continue to stay in conversation and continue to answer all the questions. We are seeing people decide to get their first dose all the time now. So even though I hear the frustration and I hear people saying, well, they already have all the information they need. If they haven't gotten it yet, they're never going to get it. I'm here to tell you that is not true. And we are seeing people decide to get their first dose all the time. So some patience and some compassion, and some really being forthright and answering questions, and getting to your primary care doctor, or urging your loved ones to talk to their primary care doctor, get their individual questions answered in a safe environment. And if they don't like the primary care doctor they have, get a new one. If you don't have one, please get one. And I know it has been quite cold out here lately. We can still try and embrace outdoor activities, bundle up, and if you're able to do things outdoors, get out. and, really kind of avoiding crowded, indoor, poorly ventilated spaces at this time. We are really concerned about events becoming more of spreader events, and we don't want this holiday season to be marked by outbreaks or super spreader events. So please do what you can to stay safe. You may want to limit who's at the party. Definitely make sure you have good ventilation. Consider testing right before any gathering. The antigen test can be done right before, right up to the minute, and it will definitely reduce the risk that you'll have a very contagious person in your midst if everyone does perform these tests. They're not perfect. We are still waiting for more information about how great they're going to be with Omicron. We know they still work, but there's some nuances there that they may turn positive kind of quickly, like even within that day. And so we're a little concerned about that. But nonetheless, testing is certainly better than not testing. So we are definitely encouraging that. Have a guest list. Make sure you can contact people if anyone does test positive. Stay in communication with one another. It really could save a life. High quality, well fitted, high filtration masks, particularly if you're going to be traveling or you're going to be amidst members of the public who you don't know. It becomes even more important to keep that N95 or KN95 on. So if you have not, take some time, do a little shopping, get you a N95, KN95 mask, and keep yourself protected. And remember that if you test positive, please inquire about treatment. It's got a little more complicated as I explained today, but it's still very critical that you treat timely and that you also isolate yourself and contact all of your close contacts. And remember to get some exercise, some fresh air, eat a well-balanced diet, take a multivitamin, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. This concludes today's People's Health Briefing. Please join us next Tuesday at 10 a.m. See you then.